Hello and welcome to another episode of The Molten Truth. I am your host, Zoe Michaels. Today, we get to actually talk with someone who has what I think is a very interesting topic, and I can't wait to dive deeper into it. But before we get started with Dr. Sal's primary topic, we're going to talk to him a little bit about who he is, his credentials, and then we're going to lead into the special interest topic. So, Dr. Sal, thank you so much for being here today. I'm glad we were able to coordinate our schedules to make this work.
Thank you so much for having me,
You're
Zoe.
very
Thank you.
welcome. So, we were talking off stage just a moment ago. You had mentioned that you are already established in a field of science. It sounds like maybe you have a doctorate, maybe. Um,
Yes, I'm a gastroenterologist, and I have experience of more than 30 years, and I'm a board certified physician and nutritionist and hepatologist. And my prime interest is in educating people about gut health and inform people about how best to approach their gut health in order to get the overall good health. So I've been doing that for many years now. The educational part on social media I have taken on since early this year and have established myself really well. And I have uh, fellowship training from Brown University and my primary residency training from University of Chicago. And I've been professor at multiple institutions and have done research and published in scientific journals and have written a couple of books and some chapters as well. So I have done overall a variety of work in regarding gut, from bench work to actual clinical studies and drug trials.
okay,
So
okay, and it's
I'm here now to just let people know that I'm here to educate, and this is my mission.
okay. That's very interesting. And we talked about gut health beforehand, but I did not put that together with you being a gastroenterologist. So you say that, and I go, oh, ding, ding, ding. Okay. Because in my day job, the job that pays the bills, puts the roof over my head, I work in the medical field myself. I work with primary care physicians, booking their doctor's
Wonderful,
appointments.
wonderful.
So very often I get people saying, okay, well, my doctor referred me to the gastroenterologist for this or for that. But um, I never think of it as a proactive um, thing. I usually think of it as, oh, someone's seen their doctor and now they have this huge problem and now it's time for the specialist to step in. But
Right.
that's really all I know about gastroenterology, as I think of that as a specialized field. So this is kind of a nice opportunity for me, actually, to get a bit of an insight into what it is a gastroenterologist really does and how they help, and if there is anything proactively that people can do.
Sure. So my work actually is, yes, we treat the conditions of GI, irritable bowel syndrome, inflammatory bowel diseases, Crohn's, colitis. But what we're seeing more and more is that in general, people lack information that they need to actively do something about their gut health. Gastroenterologists, by the time you reach there, we diagnose the cases. We do endoscopies, colonoscopies, we diagnose many conditions. But once you know that there's a lot of GI conditions which are functional, which means they are related to the gut and brain talking to each other. We call it disorders of the gut brain interaction. Those are the things that you have to take care of. As if you learn more about it as patients, you will be able to manage it, prevent, and save yourself from future um, catastrophes if you act early on and are informed about it. Just like if you take good nutrition, you take care of good your gut health, you're gonna need less of actual gastroenterology, right? From the gastroenterologist, you're not dependent on that because you are preventing. You're doing a preventive work. But once you have certain red flags, you need a gastroenterologist, right? You cannot self-diagnose. Then the gastroenterologist will go through the process of eliminating diseases, and then if they diagnose you with, suppose, irritable bowel syndrome, that's a functional GI problem. That's a gut-brain interaction disorder. Then you have to take care of it different ways. Gastroenterologists will not have medications for those things, for example. But then you have your nutrition, you have your diet changes, you have your lifestyle changes. You will have hypnotherapy that can also help your gut symptoms. You will have guided imagery and other cognitive behavior therapies. You may have yoga to help you. Those are the things that, you will have to look into. And a good gastroenterologist can actually guide you through the whole process. So one of my job is also to try to teach people to ask the right questions to your primary care doctor and ask for the referral to GI and identify and know about what red flags to worry about and what conditions not to worry.
Okay. So so for example, I'm gonna just use a case. Someone who has I would call by normal standards healthy eating habits. They eat mostly at home. They don't really eat much in the way of sugar. They try to eat very low salt. They eat, a lot of vegetables, maybe not so much fruit, but they love their meat. But they keep packing on the weight despite eating what they would consider a comparatively healthy diet compared to most Americans. I mean, is that someone who would need to see a gastroenterologist, or what could they do to affect their health? Because I think of food as medicine.
Right, right. So yes, so the important thing to understand is that the weight gain and the obesity part that we're dealing with, it is multifactorial. It has many, many reasons. But from the standpoint of my studies from gut microbiome, we now know that lean people and obese people have different kind of gut bacteria. This has been shown in the studies of mice that when they took the gut stool samples from lean mice and gave them to the regular mice and then gave them to the obese mice, they found that the obese mice started becoming lean. And if they gave the gut microbiome through the stool specimen from the obese to the lean mice started getting bigger.
Really?
So this is what we are. Like, it is our microbiome inside determines what our weight is going to be. And the important thing to take care of is, like, if your gut microbiome is healthy and diversified, then the chances are you will not gain much weight and in fact start losing. So how do you take care of your gut microbiome? So nutrition, yes, we talk about nutrition, but your gut microbiome needs specific kind of nutrition. And the most important thing is the prebiotics. And I'm not talking prebiotic from the shelves of the pharmacies. I'm talking prebiotics in food, which are soluble fiber. All soluble fiber are like prebiotics. And what is prebiotics? Prebiotics are the food that help your gut bacteria, that feed your gut bacteria. So the probiotics are the live bacteria, and pre is the food for the pro.
Okay.
So when you take probiotics from the shelves, they are actually live bacteria that go in and replenish your system. But the prebiotic is actually most important, and that is the kind of food you eat, which is all soluble fiber, which is where you come from all kinds of nuts and seeds, edible seeds. You have beans of all kinds. You have variety of lentils. You have chickpeas. Um, that is where the real prebiotic is.
Okay.
So when you eat those kind of soluble
Mhm.
fiber, the nuts and seeds, the beans, the lentils, the chickpeas, they are going to feed and make your gut bacteria stronger. When they are strong, then they're going to send signals throughout your body They create insulin sensitivity, so your insulin resistance and diabetes will improve. They regulate blood sugar, they regulate blood pressure. All these kind of substances that these bacteria, the gut bacteria, will create after eating this prebiotics. So this is not only the colon health that they will establish, but throughout the heart, the blood pressure, the kidneys, um, and insulin resistance and diabetes. It affects everything and the weight
Okay.
because it creates that satiety, it creates that satisfaction. So this prebiotics also creates um, satiety in your stomach, so you stop craving for food, and that is how you start maintaining your weight too. So again, good. And when you talk about probiotics, we have to make sure that you know that the yogurt with the live
Mm-hmm.
cultures, sauerkraut, sourdough bread, and kimchi, and pickles without the vinegar, they are all good sources of live bacteria. Okay.
Okay.
If you take these on a regular basis and you eat enough of prebiotic food, chances are you're not going to gain more weight and slowly start losing. So the other thing is important is like metamucil or psyllium husk fiber. That has been shown that if you take that on a daily basis, every day, 1 teaspoon is 4 grams in a cup of water. If you take it twice a day, the metamucil fiber, it sits in your gut and it gives you the feeling of fullness. Besides working on you reducing your blood sugar, reducing your blood pressure, and creating better heart health and gut health, this psyllium is actually going to stop you from eating too much and you start maintaining your weight. So if people take this on a regular basis, they will definitely start losing some weight over a period of time, and they're not going to crave much food. Again, eating the right nutrition, the right kind of food is important because that is where your gut microbiome starts changing. If you eat highly processed, ultra processed food, okay, your regular healthy gut bacteria are going to start dying, and they will be replaced with other harmful bacteria which will have more role to play in your gut, and your gut lining or the barrier will start getting damaged, so the toxins and other chemicals are going to go into your bloodstream and have a reverse effect because they will create more problems for you. And this is why we're seeing increased number of heart diseases and blood pressure issues and diabetes and obesity because of the gut microbiome that is damaged.
And so let me segue into this because I had asked you about your website earlier on. So gutsavior.co, your website.
Mhm.
Will we find a lot of that information and guidance on that website, or what kind of information will we find there?
So I want people to actually, there are some free information, of course, about what kind of red flags that you should be worried about so that you can reach out to the doctor and the gastroenterologist can do something about it, and also what kind of questions you need to ask your doctors in order to get the best care in the little time that you have with your physician. The more prepared you are, the more proactive you are, the more you're going to get out of that doctor visit. Your doctor has limited time, and you cannot expect you go in and everything's going to be fixed if you have no information, if you're not armed with any knowledge or information. So this is where you start somewhere higher, then you get higher and higher amount of information. So that is what I like to teach. And then I also offer one-on-one as a second opinion for anybody who wants to have questions. And I make sure that I'm not telling them that I'm giving you a treatment. It's not, I'm not prescribing anything on that website, but I can meet one on one to help you guide through the whole process to help you navigate the system, ask the right questions to the doctors, and maybe help you find ask for diagnosis and ask for the workup that might lead to the possible diagnosis. So it will be like a second opinion that I can offer for 30 minutes or 1 hour or 2 hours.
Absolutely.
So that's another thing I do. But the premise is not treatment. The premise is so much educational and guidance.
Yeah, and I think there's a lot of value in that because really, unless you take the time to really dig in and research, we're lost. We go to the doctor's office and we're completely lost. Even when we look at a lab report that we get back, sometimes even before the doctor sees it, we're looking at those lab reports going, oh my goodness, we must be so sick because we see, oh, this says abnormal, this says abnormal, and we're conjuring in our mind the most worst case scenario. And then we get this message back from our doctor, your results look fine,
Eh,
take a little this,
Yeah.
take a little that.
Right, right. This is so true. This is so true. So yes, but so that is why it's most important that you ask the way the doctors
Mm-hmm.
think. We need to know that. Public should know that. Then you ask the question. So there are people who come to me, patients over and over, and they say that the doctors haven't given us any diagnosis, and this is not fair. So one has to ask the physician, like, what are you thinking, doctor? Vocalize. Because doctors are still in that attitude and in that frame of mind that I will give them the answer when I have the answer. But then you should communicate more with your families or your patients who come to you that look, so the right kind of question would be, doctor, what is the diagnosis? And the doctor says, we still have to investigate. Okay, doctor, what is your differential diagnosis? What are the diagnoses you are thinking and going to eliminate? At least tell me that. So then now the doctor is interested when you use the right term, the differential diagnosis. Now he's going to say, okay, the possibilities are IBS, IBD, ulcer, this. And then you ask, okay, what is the most likely scenario?
Right. It's almost like
Then the doctor will think, it's almost it's like doctors are like Chat GPT.
I was just gonna say that.
You
Yes,
have
exactly.
you have to be very specific.
Yes.
Specific questions you ask, you get the right answers. So,
Exactly.
okay, doctor, if doctor says I need to do endoscopy, why?
Mm,
Do you need to do the procedure? And if we don't do the procedure, what are the things we can do without the procedure?
right. Exactly.
So if you are you know about these things, then the doctor can say, okay, I can rule this out, rule this out, rule this out. But it is also possible that the doctor might not have considered. Some doctors are very, make a diagnosis very fast. Others take a long time. So the first thing I do when the people come to me, I give them a diagnosis. Most likely diagnosis is this. Now I'm going to rule out this condition with this blood test, this condition with this investigation, this condition with this imaging and CT scan. Why am I doing everything? Everything should be known. But if we don't ask, we look like, and to be frank, I mean, I was like that before the medical field, before becoming a physician. I would go and think my doctor would figure everything out. I don't have to. I'm hesitant to ask the question and things. This is a patient mentality. We feel that doctors will figure everything out. But you have 10, 15 minutes and you're going to be sent back home without knowing anything.
Well, it's really kind of an unfair proposition when you think about it. You see a patient for 10, 15 minutes. You don't really get to
Mhm.
see them in their day-to-day life, so you don't get to see and how they live, what they eat. You can only rely
Right,
on what they tell you, assuming that they're being 100% truthful and everything and not forgetting to tell
right,
you all the things. And then on top of
exactly.
that, if you are wrong, then there's a liability issue because people will hold you
Right.
to your words. You are the expert. And, that's really there's a lot of expectation for
It's a
very
difficult
little.
situation. It's a difficult,
Yeah,
right.
yeah. I mean, it's
So it's a
amazing.
difficult situation,
It's amazing that you guys do
but at
what you
this,
do.
no, thank you so much. So what I also like to do is that once I give them a diagnosis, then I have a board, the whiteboard. So actually I write the diagnosis for them. I draw pictures and then I tell them to take a picture of that, what I made. Because this is another thing. We forget 60% of information by the time you leave the doctor's office and get into your car, you have lost 60% of the information.
I can vouch for that.
So if I,
I get
so
so
if
many
we don't draw
calls.
pictures, if we, so yeah, so you have to draw pictures and give them the chance to take, to take a picture, keep it so that they can go back and say, oh yeah, he said this, he said that, yeah, we can, and share it with other family members. So that's another thing that, we need to know. The doctors need to know the patient's going to forget a lot of stuff.
It's so true. Even with the absent
For
summary,
some,
they're
yeah, go.
still missing information.
Yeah.
Go ahead. I'm sorry.
It's yeah, it's not much. No, 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 no. It's true. It's not there much. But I now have I don't mind people doing what they say, doctor Googling or chat GPTing, and then they get information, and which is all I recommend doing it. So you learn and you ask the right questions. But we need to know that we have to confirm things with the physician, right? You
Absolutely.
cannot depend on Dr. Google and ChatGPT to make your diagnosis.
Absolutely.
So, but
Yeah, ChatGPT is a good sounding board for I think I have this, and these are the symptoms I'm having, what are the questions I should
right,
ask my doctor? That would be really good use of ChatGPT just for the guidance on
perfect,
what to
perfect.
ask a
Yes,
doctor, not asking it to diagnose because it
right,
is not a doctor. Ultimately, you do
right,
need the doctor.
right,
But yes, yeah, it's all in how you
right.
use it.
So, so if there is any oversight or something, you can still bring doctor that is it possible that I have this condition? Yeah, and I'm telling you from examples. A 15-year-old girl walks into my clinic and she says, "Doctor, I think I have this condition." And I'm like, how? She said, I did all the research. I put in the chat GPT. This is the condition. This is I. So I sit with her. I examine everything. I go through the test and stuff. And she was 100%
Yeah.
right.
I
That's exactly was her diagnosis.
and I feel like people usually do have a good instinct about what's going on with their body.
Yeah.
ChatGPT aside, Google aside, people usually have a pretty good instinct about going what's going on with them. But I was amazed even with that, and I think it's a good thing that when a patient calls in to schedule with their doctor, even though they're telling me I have the flu or I have, this specific thing,
Right.
we don't ever put that they have that specific thing. We ask, what are your symptoms? And that's what we put in the appointment
Symptoms.
notes. That's
Exactly.
what we put the appointment notes for the
Right.
doctors
Right.
because we want, I'm sure the doctor
Correct.
doesn't want to have that preconceived notion. Doctor needs to know these are your symptoms and am I going to arrive at that
Right.
conclusion too? Or am I going to go, no, actually, it's
Mm,
this over here. So I think that's very
right. Right.
wise that it
Right.
is the symptoms and not it's this diagnosis that I have decided myself that I have.
Correct. And the most important thing was also to know that every time you have lab tests,
Mm-hmm.
if it says abnormal, they said don't take it to heart. Let the doctor look at it, and then when I look at it, I say not unremarkable or
Mm-hmm.
nothing special,
Yep.
and then they are relieved.
Yep.
But so there's lots of the lab is designed to just churn up even zero point 0.1 or zero point 0.2 variation. It's gonna say abnormal.
Well, and I would
But if
think,
you've seen enough cases,
yeah,
right?
yeah, I would even think the more
If
medications
you've
you're
seen enough
on,
cases, then
the more abnormal results you're going
right.
to get because it's changing your body chemistry. I mean, is that
So
right?
that's right. That's right. Sometimes you can have some abnormality, but it's just a variation. Like we all have some variations, right? So if they say that, your number should be 12.5 to 13.5, but if you are 13.8, but I've seen even 14. So that is why the experience counts. If you've seen so much over 30 years, then you know what to worry about and what to ignore. So that is how it's done. But I also like that patients should use more portal to connect with the physician directly also.
Yeah.
That is also very important now, and it's happening more and more. The patients can ask question directly to the doctor through the portal. And I think all these changes are remarkable.
Yeah. It's a nice resource, and it's an amazing thing that people have greater access now to their doctor than ever before. Um, Even the fact that they could even do a video visit, assuming that their insurance allows them to do a video visit. That's
Oh, yes, yes. No, video visits have changed because now you can do more of those,
yes,
and you don't have to wait 3 months for follow-up.
right.
Within 3 to 4 weeks, you can do a quick video visit with your doctor. And I think multiple visits make sense because, one time you see and the doctor says come back in a year, I think that's not the right practice. If you have symptoms, you're giving them some medicine, you should see them more frequently.
Absolutely.
So part of it is also like, but if as patients, if you are not proactive, you will get tremendous difficulties. The system is still archaic.
That is true.
Navigating through this whole complex of medical care is very, very difficult. As a patient, sometimes I've felt myself going through so much, and I imagine I'm a doctor, and I still feel the system is so archaic that if I am not proactive, things are not going to move,
It's true. And
and they're not going into the right direction.
so true. And it's a combination. Some of it is the, medical practice itself, but I think a larger part of it is all the hoops that the insurance adds to it. There's so many
Correct.
hard stops and extra hoops to jump because, oh, the insurance won't cover this, but if you jump this hoop, this hoop, this hoop, then maybe the insurance will cover it, or they'll say nope, you can do this instead. And I don't think people realize to what extent insurance controls things.
Oh, yes, it definitely plays a very strong part in doctors' decision-making
Yeah,
process. But again, I'm telling you that you, for example, Zoe, like if you go to your doctor, you're going to say, if you know that your condition needs special care, you have to ask your primary care doctor, is the dietitian available to me, doctor? Can you refer me to? Is a GI available for me? Because I think these symptoms are bothering me and I'm concerned. I want a gastroenterology referral. I want a dietitian referral. I want a psychologist referral. If you are not saying, this uh, proactively, you're going to sit. The primary care is going to see you, give you a prescription, tell you to come back in 6 months. 6 months have gone by, another 6 months have gone by, another, and you're suffering through the whole process. When a gastroenterologist could have easily done an endoscopy, colonoscopy, and if there's a diagnosis to be made, done it and solved it. Time and time again, patients are coming and telling me, I wish I was referred earlier.
so that's not going to happen
I wish
automatically.
I was referred to it.
So
And that's the problem.
primary care physician's not going to
You
say,
will.
hey, I think you need to see a gastroenterologist because of these symptoms. They're gonna try to, like my doctor said, well, Zoe, we know that you need to lose weight. You're aware of that already. Here are some book resources, some research for you, and that's where we left it. So
Right. So let me tell you something. So now everybody's on these GLP-1 agonists, right? Because of the weight and all that. But we still have some older weight losing for weight loss medications like Orlistat, but nobody's mentioning them. Why not? by reducing fat absorption, those medicines in the past, they were being used. Yes, you have to consider the side effects, you have to consider everything. But if Ozempic is not covered, if Wegovy and these are not GLP-1 agonists are not covered by insurance, there are other cheaper medicines which previously people have tried. If they can help you, if probiotics and prebiotics and Metamucil can help you, why are people not talking about these other ways of doing things?
Yeah, they're focused on the flavor
Right?
of the
So
month.
my what right. And so unless we know that we have to ask these things. So the incentive sometimes for the primary care physician is to not make too many referrals.
Mm,
If that is an incentive, it's counterproductive to you as patient.
yeah, yeah,
Correct? If they're looking at the doctors, primary care physician as gatekeepers who are not raising uh, the healthcare cost by reducing referrals to subspecialists, by reducing imaging studies, by reducing extra CTs and MRIs, then as a patient, unless you ask, unless you are strongly advocating for yourself, you are not going to move forward.
okay. So that's good to know because I've always assumed that
That
if I needed a referral, my doctor would simply refer me to where I needed to go. But that's not the case at
that is
all.
what's not gonna happen.
Okay.
No, it's not gonna happen. It's then depends on that primary care physician's own understanding of himself or herself. If they are humble enough to know that this is beyond them early on, then they would refer early on. They should do what ethically is the right and morally is the right thing to do. But unfortunately, that's not what they are compensated for.
And it may even be
So
company
there
policies
is an
behind
inner
that.
conflict.
Right.
It isn't, yes, that is right. You are dinged for doing extra referrals.
Mm, yeah. I could see where that could be the case.
So it's against, and so that can be important. So if you know to ask, that is why I want people to be very educated about this, and I make a lot of reels on Instagram about it. That look, ask this question, ask this question, ask this question. If you have these symptoms, these are the possibilities. If the doctor is telling you you have irritable bowels, you can ask, have we excluded celiac disease, doctor? Can we do that before we label it IBS? And some doctors can forget about that. Like, may not even have considered, like it would be an oversight. But if you are well read, if you know, you can ask the doctor to get things done.
Absolutely. Well, just in
So I
this,
think information for patients and yeah,
yeah,
go
no,
ahead.
no, I didn't mean to interrupt you. I'm just, my goal had been just to kind of help our audience understand your credentials and maybe learn a little bit myself, of course. But I have to tell you, even though I'd heard, the terms prebiotic and probiotic, I never fully understood the prebiotic terms before you explained these to me. So I think that's maybe something I've been missing out on all this time. So it's almost like I've been using baking soda without using the vinegar as the catalyst. In my head, that's kind of what the picture I'm missing, where that would be like a powerful cleansing agent type of thing.
Yeah, right,
So,
right, correct. And the diversity. This is another thing I often question. You have 100 species of bananas,
mhm,
and all we eat is the Cavendish Chiquita
yeah,
bananas. So there are baby bananas, there are purple bananas, there are plantains. All of this, the more diverse your food is, the more colorful your food is, the more good bacteria is going to engage, more diversified and active and healthy gut bacteria you're going to have,
strong,
right?
strong
And that
claims.
will determine your fate.
Yeah,
Yeah, that will determine your fate,
and
your weight, your heart condition, your blood pressure, sugar, and your colon health. One handful of nuts and seeds every day, just a fist, will prevent you from getting colon cancers, reducing the risk by 20%.
that is interesting.
And only 11% of Americans get the handful of seeds and nuts every day.
Absolutely. My ex-husband used to
So
eat.
you know what prevents cancer, but you don't want to do it.
Exactly. I mean, I used to watch him eat this way naturally. I thought, he did it just because that was normal for him, but that explains why he was always so bone skinny. He it was already eating all these ways that you're talking about. That was his normal diet. He was born and raised in Ecuador, and that was
Right.
how he grew up eating. And you know,
Mm.
I never saw that.
So different cultures, we still have a lot of to learn from it. My biggest concern now, for which I have applied for a big grant from for rural support, is childhood obesity.
Mm,
And with obesity, children are getting fatty liver disease,
yeah.
type 2 diabetes, metabolic dysfunction. All of this is happening, and it's like pandemic kind of a situation. So we have to create a culture and where it's an easy access for nuts and seeds and difficult access for chips and cookies and crackers and other processed
That's
food.
so true.
So if you look at different cultures, like if you go to Emirates, for example, if you go to their homes, even in like some Asian countries, you in on the coffee table you have all these different kind of nuts sitting there. So if children are in raised in that kind of home where it's very easy to get your hands on fruits, vegetables, and nuts and seeds, then they will not open up these packages,
Yeah.
right, of cookies and crackers and chips and all that. So, how easy you make things for people is what will determine their habit and behavior.
That's an excellent point. You know, I grew up in a house with 5 kids, so money was tight for my parents. But I'll tell you, we had plenty of oranges and peanuts, and those are mainly what I remember eating as snacks as kids. We had lots of fruit and lots of nuts because they were cheap.
Wonderful.
And
Right, right.
you know,
And eating always with the greens first will also reduce your other caloric intense
yeah,
food, right?
right.
That's the reason why Metamucil and greens, they're going to fill you up enough that your natural, and then the most important thing is also chewing a lot. So if you chew food long enough, you get more and more satisfaction out of smaller amounts.
Sure.
So these are some of the things you can do. And also beware of like innocent looking natural juices.
Yeah, I don't touch juices.
They're not innocent.
They're full of
They're
sugar.
not innocent pop. Yeah,
Yeah,
it's so, and sugar is the main culprit that increases the weight
yeah,
eventually. So
yeah. Yeah, I only have
so it
soda
there was some
with pizza on rare occasions, and I don't do juices at
mm,
all.
right, right. And the other important thing, Zoe, is that to know that with people go with the diet drinks, right? But they are more dangerous to you because they themselves can cause obesity,
I've heard that
even if they are
before.
sugar free.
Yeah,
Because it creates the craving more for real sugar. Because you try to trick your brain through your tongue. The tongue tells the brain that this is really sweet sugar, and the brain is anticipating, but the brain doesn't get the real sugar because it was this artificial. So the brain drives you more to, hey, you promised something was coming, but nothing is coming. So people who start the diet drinks over a period of time, they need to take more and more and more of diet drink
well, it's like the low-fat
in
snacks
order.
versus the snacks that healthy snack that has a healthy amount of fat. You know,
Fat,
you
correct,
want the healthy
correct,
snack that has
correct.
the healthy
Yes.
amount of fat from like coconut oil or something. A good
Mhm.
source.
Exactly. So that gives you that satiety, that
Mm,
satisfaction, right?
absolutely. I
Correct,
remember back in
correct.
the 80s and 90s, it was all about the low fat snacks. That was such a big deal back then. Um, People didn't know better.
Other thing I wanted Zoe, I wanted to make sure that you, the most recent research that I want, the viewers and the audience to know about this is that a lot of overweight and obesity issues of the future, they start with early infancy. Early infancy is where everything starts. Birth process is where it starts.
Really?
And so kids who are born by C-section and the kids who are not fed breast milk, they have a different microbiome. And that microbiome is more likely to produce obesity and other chronic conditions in the future.
Really? Now that is interesting.
Again, that is very, very important to know because when the baby is born through the natural birth canal, they get a good dose of healthy bacteria that colonizes their gut and the skin
Mm-hmm.
and the respiratory tract. And that colonization with healthy maternal bacteria will determine their future. And then through the breast milk, they get all the right kind of food,
Okay.
the prebiotic kind of thing, and the probiotic for the gut bacteria to remain healthy. And that will save them from future crises of health. The other thing is that the early use of antibiotics and early use in infancy, early use of antibiotics and early use of acid cutting medications leads to obesity in the future also.
Okay. Very good to know. That's
Because and throughout our lives, the antibiotics use will damage our regular bacteria. So so another thing to ask your doctor if he's very easy or she's writing prescriptions of you have sore throat, yet antibiotics. Ask your doctor, do I absolutely need the antibiotics, doctor? We have to be careful because it can kill not only the bad bacteria but also the good bacteria,
I get that.
and that will take a long time to regenerate, and that in the meanwhile can create problems for us.
Absolutely. I've always made it my goal, and I've been mostly successful, to try to stay away from medications as much as possible. I have this thing with my doctor that, as long as I don't need to be on a medication, I don't want to be on a medication. If it's necessary, I will take it. But if it's avoidable, then I would rather avoid it. So far, I've been successful. It's one of my it's the one downside of working in a medical field that it's absolutely required to get a flu shot every year. I do it because my
Yes,
job
yes, of
requires me to
course.
do it, but I would so much rather not.
Yeah. Actually, it's a very important thing to know that, flu shots have really saved a lot of very sick patients. Respiratory illness, as you're growing older, you're still very young. But if you are like in your 50s, 60s, 70s, the flu can really wipe you out.
Yeah.
Flu can really wipe you out. And it can turn into the bacterial pneumonia eventually and can lead to really bad sickness. And it's important. I think that we take flu shots very seriously.
Yeah, I
But the medications that we take by mouth, all of those can be, we can ask, we can double check, we can ask a second time, like, is it absolutely necessary?
yeah.
Because our gut is affected by everything we're taking.
Yeah. Yeah, I would guess that to be the case. Um, you know, I took the flu shot. It is what it is, but I I still don't know that I would want to do it every single year. Just because I've always had, I feel like, pretty good immunity otherwise. But that's just me. But definitely on the medical, taking the prescriptions, I do try to
Yeah, you have to
minimum.
question. Yeah, you have to question.
Yeah, yeah.
Correct,
Even
correct.
if I have to take it, like there was a point in time where I did need to be on what was it? Mm, some anxiety medication. I forget the name of it. I got off of it as quickly as I could try to get off of it, and I was successful in getting off of it. But But sometimes you just need to take it.
So talking about yeah, so talking about the anxiety and they are also connected with gut health directly through the gut brain axis.
Really.
And the more healthier your microbiome is, the less anxious you're going to feel. So that is another thing we have learned, that it's the brain gut connection that is affected, and it's the chemicals that are secreted in the brain are the same as they're in the gut many times. So, for example, serotonin that plays a role in anxiety, only 5 to 10% of your body serotonin is secreted in the brain, 90 to 95% in the gut.
So
So,
diet
it,
change can really help in that goal to get off of anxiety medication.
exactly. So, the soluble fiber, high degree of soluble fiber, less stress, which is like prebiotics, of course, those will all help build up your um, bacteria enough that you are going to be less likely. They're going to send positive signals to the brain, and the anxiety and the stresses are going to come down. Your sleep is going to get better.
Yeah, I was on that anxiety medication for not quite a year. I managed to get off within a year, and it's the only time in my life I've ever had to take anxiety medication, I'm happy to say. But it's good to know. I mean, if I think our audience will be glad to know that, because there's bound to be someone out there who would love to be off of anxiety medication, and maybe that's the information that they need to help them with that. So
Right,
I don't want
absolutely.
to.
So there is a way. Yeah, go ahead, go ahead,
No, finish your
go
thought.
ahead. Sorry
Please
to
finish your
interrupt.
thought. Not at all. Finish your thought, please.
No, the what I was like, that is the reason why irritable bowel syndrome patients have a 70% to chance of having anxiety or depression, and vice versa. Those who have anxiety and depression have 70 to 80% chance of having gut issues like irritable bowels because of the gut and brain connection. If you keep the gut healthy, the brain gets healthy. If you keep the brain healthy, the gut gets it. Then they are both connected through this microbiome health. Again, I cannot emphasize more about how important our, and you have 100 trillion bacteria inside you,
Absolutely.
and your own body cells are 20 trillion. So we as humans are more bacteria than we are humans.
Bacteria and water, that's all we are. But,
There is a reason why we got them, right? Because they're doing work for us. They're doing work for us to keep
absolutely.
us healthy. And
Absolutely. It just comes back to what I've always thought: food is medicine. We have to take care of ourselves, eat the right things so that we can have a healthy mind, healthy body. But we need that guidance
I
from
would
experts.
recommend
Go ahead.
I would recommend 2 tablespoons of yogurt for everybody for every day.
Wow.
Because this is something you're going to, and yogurt which has live cultures. It'll say in the back of the container, live
Yeah.
cultures, lactobacillus and all that stuff. So, but because if you are taking half a cup of it every single day, you're giving yourself enough of probiotics that you don't have to go buy things. And you can create your own pickles at home
Yeah.
with salt and water, and that will be your probiotics.
And then
And kefir, if you can take a little bit of kefir every day, that'll give you enough for probiotics. So you have to do something so that you don't depend on extra, supplements
right,
from outside.
right. And then the prebiotics also have to be taken daily, right? So like a handful of nuts or seeds every day as well.
Exactly. Correct. Absolutely. So that way you are giving pre and pro, taking care of both things together.
I'm picturing in my
Your
head
bacteria, you're
sunflower
getting
seeds.
bacteria and feeding the bacteria as well.
So sunflower seeds
Yes,
mixed in
all
my
kinds of.
yogurt would work.
Yeah, absolutely. The best seeds are the chia and the flax seeds
Okay.
are the most precious.
Okay. I could get down with, like, a little bit of crunch in my yogurt and a little bit of fruit mixed in. I could
Right.
get on board with that for breakfast, as kind of like my breakfast slash medicine type of thing every day. You might have just
The
not
other
healthy
thing I would
habit.
also No, it's a good habit. Yes, it's absolutely good habit. The other thing is that, I think up to uh, intermittent fasting is also another thing
Yes.
that we should consider
Yeah. I'm a big fan of that.
for because yeah, so that kind of they have found a 5-7 the 5-7 diet. They have gotten enough of information on that. Like 5 days you eat everything that you want to eat, and 2 days are a little bit restricted, calorie restricted. So if you do this 5-2, 5-2, 5-2 ratio every week, chances are you're going to maintain your, all the um, complete health as well as gut health as well as the body weight.
Absolutely. I know I've read Dave Asprey with the bulletproof. I love his coffee, his bulletproof coffee, and I was just about to go back onto his bulletproof coffee and try to get back into the fasting mode. Right now, I'm listening to a book by I think it's Dr. Lisa Pell's "Fast Like a Girl" because we are just our bodies are just that little bit different, and so I'm interested in
Right.
her take on okay, what as a woman do I need to do differently than a man as far as the world of fasting. So I'm curious as to what
Mhm.
insights she'll
Mhm.
have. But the idea of how the
That's amazing. Yeah.
autophagy works and how the body can eat its own fat cells, I love the science of all that.
Right. And regeneration. And it's regeneration of new cells, right? So it's stem cells are regenerated, and that happens after some fasting. So that way your body gets rid of all the toxins too. And our body has enough of toxin removal capacity through the liver, through the kidneys. And I don't believe in this all kind of extra supplements to try to detox and detox and detox and
Yeah,
all these strange enemas and all that. There's no scientific proof that they are actually helping or working, because we have been bestowed with excellent detox systems. But if you eat right and your gut bacteria is doing well, then the detox function is going to have speed up and take care of your stuff. And the intermittent fasting is also going to detox your body.
absolutely.
So we know this much, right?
Absolutely. Well, and the amazing thing about intermittent fasting, once you like get over the hump of the first day or two, you really aren't hungry. I when I was doing intermittent fasting the very first time and even the second time, I found that I had to force myself to eat. I really was not hungry. So forcing myself to even eat
Right.
one meal was like I had to make it a point to eat. But I loved intermittent fasting. So yeah, that's on my to-do list this week to get back on board with that. And now I'm going to use the tool of the prebiotic and probiotic in the mix of all that. So
Lovely.
now I do want to get on track because we teased at the beginning. This was not the main purpose of why we were talking today, although I've thoroughly enjoyed our conversation so far. I hope our audience has gotten some nuggets out of it as well. But you had reached out to me because you are helping to launch a special project that's meant to help families and not just you already help families in the medical field, but this is more helping out maybe emotionally. Do you want to tell our audience about that?
Yes, absolutely. So this came out of the of realizing that the parents raise the children, and then as the children become adults, the adults leave. We call it like leaving the nest, but they actually may not be in the same town with their work, their career. They may travel far and wide. So in our own situation, our parents were in Canada, and we were spread out from Australia, Dubai, United States. And, so we realized that as our parents were aging, we were not there physically for them all the time. And that led to this feeling of guilt and feeling of frustration, that how much more we could have done or we could do for our parents if they live in the same town. But if that is not possible, then I thought of this idea that why can't we create an app where the adult children connect with each other? And if they live in the city where the other person's parents are, then they can swap care in terms of companionship to their parents. So, like, you can have, if your parent lives in my town, my parent lives in your town, then we connect through this app and we give 1 hour, 2 hours a week to each other's parents and bring them joy, bring them some, play games, card games, or have a tea, or read a book, or listen to something, or watch something, and just so that it has been shown that it ends isolation feeling, desolation feeling in the elderly and the, our parents' age groups. So I feel that we broke the ceiling when we sat in a stranger's car when the Uber came. And we are now living in a stranger's home when the Airbnb came.
True.
So why can't we have each other's parents as our new kins now and create a global village? We used to say it takes a village to raise the kid. I say it'll take a village to have the adult or the elderly loneliness go away.
Yeah. That's such a nice concept. Especially, it's just in the news the last week or two. I keep reading these headlines about how children are being distanced from their parents. Like they're like purposely avoiding their parents, not talking to them at all. And what you're talking about is the polar opposite. It's, hey, my mom and dad, I love you so much, but I can't be there in person. But, maybe we can find
Right.
someone local who can fill my shoes, to, give you some personal attention. And then I'll do the same for their relatives over here. I mean, what a nice
Mm.
concept.
Yeah, thank you so much. It was, yes, it grew out of this feeling that we can be kin to each other. We have to come as global family. So that's why I have two names for this. One is Be My Kin, and the slogan would be "Would you be my kin?" And the other one is Kinfriendly. Kinfriendly. I'm still debating which one to name it once the product is launched, but I like the one with the "Be My Kin" because it's an invitation that we are creating new friendships, new relationships, and that way. When they are with each other's parents, they can through the portal send pictures, just say hello, and they can also keep an eye. Studies have shown that those nursing home patients who have some visitor on a regular basis,
Get better care.
they have less chances of exactly and less chances of abuse and stuff,
Mm-hmm. It's so true.
which is so important. So if somebody is there, your representative, keeping an eye on your mom and saying that, can you please check? I saw something that I didn't like, So can you be my ears and eyes for my parent, and I be the same for you? So I think that way we will take care of our, and people have shown, the studies have shown that once they have visitors, their outlook on life changes. Their feeling of they become more vibrant. They become more interested in facing the challenges that they are, because they're always looking forward to this visitation from their kids. The other important thing to know is that we have there is always one sibling who's going to become a primary care for the elderly
Right.
while other siblings are away. And that primary child or the adult kid would eventually become burnt out and feel quite depressed
True.
because of all the pressure. So if this kin family gets popular, then we can still have each other's parents sometimes change, do separate care, because now you are not so much emotionally connected that you're getting burnt out, because you are now doing a little bit to your other kin's family,
Absolutely.
and they are going there instead of you. So it'll lighten the burden of the of the primary provider, also primary caregiver in the case of siblings. So I'm looking at all these things because I felt so miserable that I was away. Even when I tried living close in Canada, I gave Canada a chance to practice medicine there, but I was not happy. So after a few years, I went back to United States. So this tells me that in spite of our good efforts and our goodwill, sometimes we're not able to stay close to our parents. But we would love to have, like, someone who matches our ideals, and the app will match you, give you 90-95% connect, not only geographically, but also, like, if your parents have like ethnic need, or they say that we need this language from somebody who comes to me, so that it'll match the right kind of person
That's good.
to you.
Similar background, perhaps similar belief systems,
Right.
because I mean, that
That's
can
correct.
factor
So
in.
then exactly they would feel like so this is what I when I meet with people, and I explain to them that this is what I'm trying to do, and then I talk to the elderly people also. And I said, wouldn't it be fascinating that somebody younger than me and better looking than me comes sometimes to see you once a week? How would you feel about that?
That they laugh.
Yeah, of course. Yeah. So this is like, they would say, yeah, yeah. So transgenerational bonding is also important,
Yes,
correct?
absolutely.
We just because you are 80 plus or 75 plus, should you be just left out of the world, connection? So the young and the older connection will be made through this app again one more time. It's a big vision, but somebody tells me that it could be an Icarian or dream or becoming overly ambitious for me. I may get burnt out by if this thing doesn't fly. But if we don't think outside the box now, how else are we going to tackle this crazy problem of elderly isolation?
Absolutely. You have to at least put the effort out there. It may not fly, you know? How many test
Right,
runs did Wilbur and what's his brother or Orville go through before their plane finally flew?
right, yeah, right, brother, right, brothers,
Exactly. I mean,
correct,
sometimes the plane's going to crash a few times before it finally takes off. That may just be part of the process,
right.
but eventually it could take off.
It may take off. Yes, it will. We'll watch and we'll see. But I'm optimistic. And thank you for listening to me
You're
and
welcome.
giving me
Yeah.
feedback.
Well, I think there's
Giving me feedback on.
certainly a need for it. We've seen it time and again where people are alone by themselves. Their family gets burned out. You mentioned one primary caregiver because maybe they're the one that's there in
Hmm.
town, and they're worn out.
Exactly. They're in the same town, and they're
So
exactly because they are the one who are facing it all the
so
time.
they could use the
Just
backup.
because they're in town.
They could use, I guess
Of
a couple
course, of
team
course.
members to help, you know, I'll never forget,
Right.
when I was a girl, my grandmother refused to move from Northwest Indiana. She was determined to stay there. And my parents wanted
Mm-hmm.
me to go live with her. And I said no, because I was 16, 17 years old, and I just wasn't prepared to do that.
Right.
My brother wound up going
All
instead,
right.
my younger brother, for about a year.
Mm-hmm.
He came back
Mm-hmm.
a very different person, and not in a good way. But then
Oh, really?
not in a good way.
Oh.
and
Mm-hmm.
but at the end of the day, my aunt, the youngest of her children, who lived there in
Mm-hmm.
town, ended up being the sole person there taking care of our grandmother.
Yeah.
And I'm sure it wiped her out on top of her, family, because she had a husband and two children of her own on top of this responsibility.
Correct, correct.
And my
Yeah,
grandmother
yeah.
was high
Now this
maintenance.
is this, yeah.
so
Wow.
so and then at
Yeah.
this point she was in a assisted living facility. She wasn't in a full-blown nursing home, but she was in an
Hmm.
assisted living facility.
Hmm.
And yeah, she could have
Right,
used some
right.
backup.
And I'm telling you, like studies have shown the primary caregiver sibling has a 25% chance of physically getting ill and 33% chance of mentally ill,
I believe it. That same
getting
aunt,
mental.
youngest of her four
Yeah.
siblings, was also the first one to die. She died of cancer. So, you
Mm.
know what? Case in point. I'm not saying my grandmother gave her cancer, but then again,
No, no, no. But then I mean, there is
there
a,
could be a
yeah.
link.
With all good intentions, with all good intentions,
Mm,
we have to take care of our own health as well. Correct.
absolutely.
But so far, everything that's available now for the elderly is you pay. You just farm it out. You know, a third party. You pay them to go visit. You pay them to go company give company. Here, there is a motivation, there is an element of voluntary spirit, there is an element of giving
Yeah,
back, and that is what will bring the world together.
absolutely. In my mind, I can't help but wonder if there might be something even for the ones who are older, perhaps that are childless or whose children have passed away, if perhaps it would give them something also to do to be able to be volunteers for people that they wouldn't have thought to volunteer to spend time with. You know, maybe they're not in a nursing home yet, but maybe that's their future. But I wonder if there's maybe something in there in the mix where they could also volunteer and not
I love
necessarily,
it. I love this idea.
you know.
I love this idea. Thank you so much for bringing it. This is, I will definitely consider this, you know, this. I didn't think of it, but thank you for bringing it up. It's novel, and I think we should think about them as
Yeah,
well.
but there's just so many lonely
When I
people.
was talking to exactly, and I talked to a college student, just bringing this idea, and she tells me that why couldn't it be us college students go to each other's parents' place because they are empty nesters. They are younger, but wouldn't they be like, oh, my daughter is going to this girl's family and this girl's coming to me, you know, once a week? And she and the college kids often feel very lonely in strange cities away from their home.
Yeah,
Wouldn't they like a good fresh meal from the and vice versa?
yeah, yeah. I mean, there's
So she
potential.
got excited, and there's a lot of potential here to create eventually with you know, would you be my kin
Exactly.
thing where we're
It's just about creating safeguards in the process because unfortunately, no matter how
exactly, we
good
will
a
have to.
system is, there are those people out there looking for opportunities to take something beautiful and make it ugly.
This is where the biggest challenge is going to be, how we're going to. But then again, Zoe, look, we were all afraid of getting in. This is why I mentioned Uber and Airbnb.
Yeah. Yeah.
Remember when it first came, we were all hesitant, thinking, "Oh my God, Uber drivers, we don't know who they're gonna be. Airbnb guests, oh my God, how can we stay in strangers' home?" All these were our fears. So now this, but and yes, there will be
Yeah.
problems,
But they can be
right?
resolved. It's just
But
about,
but then, but if we have the good, as you said, guardrails, you know, if we have good mechanism of vetting
yes.
people before they get on board, and some sort of, you know, reviews that tells you that these are the people we can trust, overall, if the benefit is far more than the
Yeah.
risks, the substance should
I
fly.
would agree with that. And that is the beauty. You know, Uber and Lyft and Airbnb, they've trailblazed that for us. There are those reviews. You've got your, you know, your verified customer thing, so you've got this reputation you've
Correct.
built up, this kind of credit score, so to speak. So
Correct.
you could do that as well with these situations. Um, so I hope that you're able to launch it, and I hope that it's very successful.
Thank
And
you.
I hope that a lot
Thank
of
you,
lonely
Zoe.
people
Thank you.
find someone to spend time with. You know that they.
So, and the time can be so many different ways you can do it depending on their taste. And I'm telling you, just day before yesterday, I met an older elderly gentleman, a brilliant guy who has had a good career and now retired as a
Yeah.
neurologist. He had a career. He asked me, that, is it possible that the young person who would come to me will also show me how to use social media?
Well, they
And I
probably
said,
could.
why not? Of course they could. So this is something interesting that the elderly would be like, oh, this is something interesting. I can look at what Instagram means, because this person was not aware of like how to touch the Instagram, how to use Instagram. And so he asked me this innocently, that if somebody is coming to see me, maybe they could show me how to use this.
Absolutely, but that also speaks to how lonely they must be if that's something they're interested in. They
Exactly.
need that
That's the point.
interaction, but really, social media has its uses. I have no beef with social media in principle, but it's no substitution for in-person or interaction. And I wish there was
Correct.
a way that I wish there was a limitation on how much social media interaction could be. I wish it was only allowed 1 or 2 times a day. Then oops, you're timed out, and now you must interact with the live
Right.
world. I wish there was some safeguard in place for that because
Yeah.
it's such a
With kids,
danger.
we'll have to. With kids, we will have to.
Even with
With
adults,
kids, we
we
will.
get addicted. There's such a thing as phone addiction. I'm guilty sometimes, and I have
Yeah.
had to stop and curb myself, and that's one of the reasons I get to do this
Mm.
now, because I'm live interaction, talking to someone in person instead of chatting with a complete stranger that perhaps may not be who they say they are. So,
So this is why my wife has started doing digital fasting for us
hmm,
families.
yeah,
So there's a time so now there's digital fasting, so which is where you have to give it up,
yeah, I think that's smart.
for some time to, yeah,
Detox.
that's like our detox, exactly.
Yeah, I think that's wise. It's just, yeah, you can't be too careful, and it's unfortunate. And now with the whole deep fake thing, but yeah, I would rather see people spend in time with person rather than try to interact on social media. But that's a whole other conversation, and I'm sure you have better things to talk about. So, how about we wrap up our time together with the random question from the previous guest?
Sure, sure.
So the last guest, oh, I like this. If the universe texted you online, oh, I'm sorry. If the universe texted you one line of advice today, what would it say? And would you read it or would you just skip it, ignore it?
I'll answer the second part first. I would definitely be interested in knowing what the question is, or and so yes, I would not ignore it. And if depending on like what the question is, I would like repeat it for
Yeah.
me again. First
Yeah. If
part.
the universe texted you,
It's something that I need to think about. It's a
yeah,
good
one
question.
line
It's
of
something to think
advice.
about.
So if the universe texted you one line of advice, would you think about it or would you
One
ignore
liner.
it?
No, I would think about it.
And
I would definitely think about.
yeah,
Any other corollary to this
um,
question, or just this
well,
question?
and then what would that piece of advice be that it would send you today instead of the
Ah,
part I just
that is the difficult one.
yes.
I would say that it'll tell me to um, trust um, trust the universe to make ultimate decisions and bring ultimate care and happiness to you.
Okay. All right. And you would trust that advice. Okay.
Bigger. And I would trust that trust part, because I want to remain optimist always. And I know that the universe is creating things for us as we are moving forward or going anywhere. The universe does things for us. And I think if we place confidence and trust in the universe that it's going to bring us the best in life, then it will. You must have heard, right? If you that the universe conspires to bring things to you. if you
those
truly believe in
words,
some.
but I think I do. I've heard the concept, the whole idea of positive. You have positive thoughts,
Well,
positive things come your way.
you manifestation,
Yeah,
the manifestation,
yep,
yeah.
yep. You hear that word in a million different ways, but the same essential thoughts. So yeah, absolutely. I do think a positive attitude, will help us to deal with no matter what life throws at us in a positive way and come out of it no matter what it is in a good way. So I don't necessarily disagree. I just view it maybe a little bit differently than maybe what others view it. But yeah, do you have a question for our next guest?
Yes, it would be if they were meant to be a tree, what kind of a tree would they be?
Okay, so if you were meant to be a tree, what kind of tree would you be? Tree. What kind of tree would you be?
And why?
Okay, and got it. All right, we'll ask them that random question for our next guest. Well, I appreciate you making the time to be with us today. Do you have any last thoughts or anything else you'd like to share with our audience before we close down this episode?
I'm just glad that I was given the opportunity to come here and talk to you, Zoe. I appreciate that from you, and like I said, I'm available. If people have any questions for me, they can get to my website and reach out, and I'd be more than happy to help. I wanted, as a last comment, for people to know, your audience to know, that I have no industry backing. I have no institutional affiliation in terms of the my words and my statements and my social media. There's no influence from pharmaceuticals, and I'm not selling any products. So I'm trying to establish authenticity and a voice that has done research and has evidence-based information that I feel would be good for you. 20 years down, things would change for sure. And I might look back and say, hey, I could have done better. But at this point, I think I'm doing my best to do better.
I
Thank
think
you.
that's amazing. Thank you. So we're gonna end the episode, but please hang on because I'll have some more information with you for you after we stop recording.